Hi guys, in this video we're going to talk about the arterial supply and venous drainage of the pelvis and perineum. You guys know that our arterial supply of course starts with the aorta, okay, so the aorta is already in our abdomen, and then at the level of L4 it gives us the two common iliacs, because iliac means that we are going to the pelvis, right? So basically, if this is my right and left pelvis, of course, this is not a lung and trachea and bronchi. It is the abdomen, all right? And this is the aorta. Now, the aorta gives you two common iliacs, and we call them iliacs because they are going to the iliac region, which means kind of the hip region. And then I have right and left. Now the right one will give you the external iliac that is going to go externally, and once it exceeds the inguinal ligament, I call it femoral, and it takes care of the lower limb. And then I have the internal iliac, and it goes to the iliac region, which is my hip, which is my pelvis internally. So it's gonna take care of my pelvic organs. So the internal iliac is gonna be the artery of the pelvis. Okay, so if that is my pelvis, all right, so the internal iliac, yeah, it's gonna be the artery of my pelvic organs. Now, as we reach this point, here we have the internal iliac artery, and if you guys look at the internal iliac, it's gonna give you two branches, all right? So yeah, that was the common iliac, sorry, and here this is the internal iliac. The internal iliac will give you posterior division and anterior division. Okay, and the external iliac, it's going to go proceed, and once it goes to exceeds and comes out of the inguinal ligament, it gives you the femoral. Now, external iliac is not my concern now, although it's gonna give me external branches to the scrotum and penis and whatever, but now my concern is the internal iliac. Now, internal iliac is the branch, yes, of the pelvis. So internal iliac is gonna give me posterior division, that's gonna give me only three branches, parietal branches, and the internal iliac anterior division is going to give me some parietal and some visceral. What do I mean by parietal? It means that something that's going to supply bones, muscles, fascia. Okay, so this means the parietal. It's the opposite of the visceral. Remember your layers, peritoneum, pleura. All right, so when we say parietal, it means the wall itself, what makes your wall, which is bones, muscles, yeah. So the posterior division is going to give you three parietal branches, and then the anterior division is going to give you some of them parietal and most of them are visceral from the anterior division of the internal iliac. Now, think about your pelvis as the branches are going to give you, the posterior division and anterior division are going to give you branches in order of what you're going to have. Now, if I have a posterior division that's going to give me branches that takes care of the bones, then the first one is going to be going towards my iliac region, yeah? This is my ilium. So this is to the ilium and it's going to the lumbar vertebrae, yeah? So the first branch of the posterior division is going to be the iliolumbar. Okay, now moving on, what is the next bone I have in my pelvis? We are going in order from posterior to anterior. This is how you will be able to know all the branches of the internal iliac. The iliolumbar from posterior division, and then lateral sacral, because this is the other bone that makes my pelvis. I have the iliac bone, I have the sacrum, yeah? And then the last one is the superior gluteal, because it wants to get out of that to supply structures outside, which is the gluteal region, and that is going to be done by the superior gluteal, because of course the gluteal region is part of my pelvis. Yes, it's outside. Yes, we don't explain it in the pelvis and perineal and reproductive system, but it's part of my pelvis, yeah? So posterior division is going to give you iliolumbar, lateral sacral, superior gluteal, and the superior gluteal, to reach the gluteal region, it needs to get out from a foramen, yeah, because this is another region of the body. I'm going out from the pelvis to the gluteal region. So the superior gluteal is going to be the terminal branch. What we mean by terminal branch is the biggest branch. It is the continuation of our branch. So the superior gluteal is the terminal or continuation of the posterior division of the internal iliac. Now, moving from the superior gluteal, we are moving in order. So we are still in the gluteal region, but there is a small piece of that gluteal region still down. So it's gonna take its division from the anterior division. So the anterior division terminal branch is also the gluteal branch, but in this case it's the inferior gluteal. So I have the inferior gluteal artery. Yeah, did I say nerve today? Sorry if I said nerve. We're talking about the internal iliac artery. Yeah. So the posterior division is gonna give you iliolumbar, lateral sacral, superior gluteal, and then the anterior division, inferior gluteal, and then in order we came out of the pelvis to supply gluteal region. What's the next region I have out of my pelvis, because I want to make sure to give blood supply everywhere else, and then I'm going to focus on the pelvis. It's gonna be my perineal region, guys. Yeah. So in the perineal region, it's a total separate region in my body, and in that region is separated from the pelvis by the pelvic diaphragm, and diaphragm means it's something that separates two regions. Yeah. So in order to come out of the pelvis and enter back to another region, which is in the next floor down, I need to come out from a foramen and I come down inside back to the next region. So the internal pudendal is the next one. Pudendal means shame area, same as the perineal region, the genital area. Yeah. So the internal pudendal is going to take care of the perineal region, but in order to do that, it needs to come out from the greater sciatic foramen, loops around the sacrospinous ligament around the spine of the ischial spine, and then it enters the pudendal canal. We're going to talk about that in another video, and then it enters the perineal region. Yeah. So we talked about the three parietal branches of the superior division, the posterior division, iliolumbar, lateral sacral, superior gluteal. Now from the anterior division, I have inferior gluteal to the gluteal region, I have internal pudendal to the perineal region, and now I'm ready to give the branches to my pelvis. And again, we are moving posterior to anterior. So you guys remember that when we talked about the pelvic viscera, we said that we have the rectum, we have the uterus, and then urinary bladder. So what do you expect the order of the branches as we proceed? It's going to be a branch that goes to the rectum, which is middle rectal, of course, because the superior rector talked about it in the digestive system module, that is coming from the inferior mesenteric, because that is a part of the gut, so it cannot take a branch from the internal iliac. Yeah. And the middle rectal is going to take its branch from the internal iliac. Okay. And then as we proceed, remember that again, the order of your viscera was rectum, uterus, and then urinary bladder. So after the middle rectal, I have the uterine artery. The uterine artery is going to be in female, but in male, it's going to be to artery of ductus deferens. Okay, so from the rectum to a genital stuff, and then to the urinary bladder. Okay, if that is genital in female, of course it's your uterus. If this is in male, of course it's going to be the artery to the ductus deferens. Now, because the urinary bladder is a big organ, so it needs two branches. It needs one superiorly, which is the superior vesicle. It comes out from the obliterated umbilical artery. Umbilical artery, remember guys, that was actually the connection between the fetus and the mother, but after delivery, it obliterates, giving us a ligament. So if you guys see an artery that comes from the artery, which is the umbilical artery, the artery that comes from the anterior division and it goes to the anterior abdominal wall, and you guys can see a branch from it going to the top of the urinary bladder, this is definitely the superior vesicle. Okay. Now, I have another branch that goes to the urinary bladder down. That is going to be the inferior vesicle. The inferior vesicle is replaced in female by the vaginal, because of course the vagina is down. Yeah. So And so the urinary bladder, we call it, it has, actually it's not one branch only, it's two or three branches or even more. But if you can see any artery coming from the obliterated umbilical artery going to the top of the urinary bladder, this is definitely the superior vesicle. Yeah. And forget about the obturator artery coming here. It's a bit confusing. So if you have an artery going to the superior vesicle, and then if you have one that goes down, all right, to the apex of the urinary bladder, this is going to be the inferior vesicle or the vaginal, going to the vagina in female. Now, the last one is actually the obturator artery. Obturator artery is very easily, you guys can say it very easily, because okay, so that was, yes, obturator, because this drawing was actually the obturator foramen. I was explaining this as the urinary bladder. So it's all right. Again, the bladder is actually here, it doesn't make a difference. But how do you know the obturator artery? If you see a branch coming from the anterior division of the internal iliac, and it goes to the, do you guys know that we have this obturator foramen, and the obturator foramen is actually covered by obturator fascia, leaving a canal, obturator canal. Yeah. So if you can see an artery coming from the internal iliac and it goes to the obturator canal, this is definitely obturator artery, and it's very easily to be identified. I'm gonna show you more pictures. Forget about this drawing. I feel it's a bit confusing here, but it's very easily to be identified. And that's going to be the last artery we have from the internal iliac. If you guys look at this picture here, we have the internal iliac. Yeah. This is the internal iliac, and this is the external iliac. It's cut. The internal iliac gives you posterior division and anterior division. The posterior will give you iliolumbar, something that's hidden. I cannot see it now. And I have lateral sacral that goes to the sacral region, and I have the superior gluteal that comes out from the greater sciatic foramen outside above the piriformis muscle. And then from the anterior division in order, like we said, we have the terminal branch which is the inferior gluteal. We're moving in order: iliolumbar, lumbar region, iliac region, lateral sacral, sacral region. Now gluteal region, superior gluteal from posterior division. From the anterior division, inferior gluteal. As we proceed, we have one artery that needs to go to the perineum so that we can focus in the pelvic cavity. That is going to get out from the greater sciatic foramen. It enters back through the lesser sciatic foramen to get to the perineal region. Yeah. And from there, it's going to give you the other branches, which is the inferior rectal and the perineal. All right. We're going to talk about this into details in the perineal region. And now, moving on, we have the rest of the arteries. As we proceed, remember that we have the rectum, and then we have the uterus, and then the bladder. So the artery that the turn is for the middle rectal. So if I have an artery coming after that, the internal pudendal is going to be the middle rectal. And then I have the uterine artery that goes to the uterus, or the artery to ductus deferens in male. If you guys look at the male, you will see that an artery that goes to the spermatic cord, and it supplies the ductus deferens. Yeah, it's instead of the uterine artery, everything else is just the same, other than the inferior vesicle and vaginal. All right, now, and then I have an artery that gets out to the obturator region from the obturator canal. This is the obturator artery. All right. And then I have an artery that goes to the top of the urinary bladder. So this is going to be the superior vesicle. And I also have the inferior vesicle, which is also coming from the internal iliac, and it goes to the bladder down. This is going to be inferior vesicle or the vaginal. You guys can see that it gives more than one branch. One is going to the vagina down, and another one is going to lower part of the bladder. So the vesicle or the vesicle branches can be more than two, one or two or three. Okay, so you can define them based on where you can see them. All right, now here I have a picture for the branches of the internal pudendal. So if you guys look at the internal pudendal, The internal pudendal enters and runs in the pudendal canal, and we're going to talk about that in another video. But let's see what happens as we come to the perineal and the anal triangle region. Now, the pudendal, the internal pudendal artery, once it comes here and it appears here, it's going to give me one branch to the rectum, and this is what we call the inferior rectal. Okay, remember that the rectum was having superior rectal from inferior mesenteric because that was part of the gut. Middle rectal was branch of the internal iliac because that was the artery of the pelvis. And now, because we are reaching the perineal region, the shame area, that the inferior rectal should be a branch of the artery of that region, which is the internal pudendal. So everything makes sense, right? So the inferior rectal is going to branch off the internal pudendal at the beginning of the pudendal canal. Now, as we proceed in the canal and we reach here, we're going to see the terminal branches of the internal pudendal artery. The internal pudendal is going to give you the muscular branch, which is for the perineal muscles, muscular branch. It's going to give you a cutaneous branch, which is the posterior scrotal or labial, and it's going to give you the dorsal artery of penis or clitoris. So remember that your perineal is going to give you three. One muscular for the muscles of the perineum, one cutaneous, which is going to be for posterior scrotal or labial. All right, here, if you look at this picture, one muscular to the muscles of perineal region, one cutaneous. If you guys look at the left side, it's even easier. One muscular to all these muscles, the perineal muscles, and one cutaneous, which is the posterior labial or scrotal. And then we have here, this is the cutaneous, and then we have the dorsal artery of clitoris or dorsal artery of penis. Okay, so we have the dorsal artery of clitoris or penis, and we have the deep artery of clitoris or penis. Okay, so all right, so here we talked about the branches of the internal pudendal, and we're going to also talk about them as a comparison between them and the branches of pudendal nerve, and we're going to see how will they move. Yeah, so I have it here, it's not in the other video. If you guys look at this slide, here I compared to you the difference between the internal pudendal artery and the pudendal nerve. So in both of them, as I said in the previous slide, we have the internal pudendal artery or pudendal nerve. They run in the pudendal canal, and the pudendal canal is actually a fascial sheath, which is the lowermost part of the obturator internus fascia. So as we move on, remember that I told you the inferior rectal, it branches off at the beginning of the canal. It goes to the rectum, and that's it. Now, what proceeds all the way to the perineal region is going to be the perineal artery or nerve. So from there, we're going to get muscular branch to the muscles of perineum, cutaneous branch, which is the posterior scrotal or labial. Okay, if you guys look at this picture here, the perineal, it's going to give you muscular branch to the muscles. It's going to give you here the posterior, which is cutaneous, posterior scrotal or labial, and then you're going to have the dorsal and the deep. You're going to have the deep artery inside the penis or clitoris, and you're going to have the dorsal artery of penis or clitoris. It wasn't clear in the previous picture. So this is fine, and it's there in both of them, in the internal pudendal artery and also in the pudendal nerve, and we're going to talk about them again in another videos. But I want you to know that we have two extra things, that we have them as branches of the artery, but we don't have them as branches of the pudendal nerve. These are actually the urethral artery and artery to the bulb. Right, so if you guys look at this, you're gonna see that you have the artery of bulb of penis. We're gonna talk about the bulb, and we will understand what does that mean in the perineum video. And also we have the urethral artery, and that is going to be to the urethra. All right, these are the ones. Okay, so remember that the take-home message here is we have 4 branches from the internal pudendal artery: inferior rectal, perineal, urethral, and artery to the bulb. From the perineal itself, I have three important branches. One muscular to the muscles of perineum, the transverse perineal muscles. We're going to talk about them in the perineal region. We have a cutaneous branch, which is the posterior scrotal or labial, and deep and dorsal ones to the penis or clitoris. I hope you guys understood this video. If you guys feel that you need to listen to that video one more time, just listen to that one more time. I'm sure by the end of listening to this twice, you will be able to remember all the branches of the internal iliac and internal pudendal arteries. Thank you guys for watching, and see you in next